Thank you for joining us for Coffee with the Candidates today. We have Jean Hunhoff with us here today, who is an incumbent senator representing District 18. The legislative primary will be June 4th. You can get more information on locations and times for voting on the Yankton Thrive website at yanktonsd.com. Jean, thanks for joining us today.
Well, thank you. You know, this is one of the greatest days in Yankton with all the rain that we're getting. Everything is so green out there. It is just absolutely fabulous. And I bet the farmers are ecstatic because of the moisture.
I would think they would be loving this, definitely. So why don't you go ahead and start by telling us a little bit about yourself.
All right. Well, my name is Jean Hunhoff, and I have resided here with our family here in Yankton for probably over 35 years. I grew up in Tabor, and everybody knows that. I am a Tabor at heart because that's my hometown, and certainly try to get engaged and stay engaged over there and keeping things active. But more importantly, here in Yankton, I am a registered nurse. I'm not currently practicing. I worked for a little over 30 years, first starting at what was Sacred Heart Hospital and then moving into Avera at Home and working with their organization. So had a long career both in hospital and nursing administration, and certainly my emphasis has always been home health, hospice, and palliative care. So really got those programs going both in the organization and on a statewide venture, did some things that way. When I got out of the nursing, I went into business with our son Matt and his wife Kelsey, and Dan was in it at that time, but he sort of backed off, and we opened Checkers. And Checkers was really a dream of mine. In Tabor, you went to Mass and you went to the bar afterward, and that's where the family socialized and the kids were there, and you really had great times, and wanted to recreate that. Matt sort of had that same thought process, so we have Checkers, and we really cater to families because it's really great that a mom and dad can come out, they can have a evening, have a relaxing time and don't worry about the kids. We've got a lot of activities there, and so that has certainly grown to a benefit for all of us as far as I'm concerned. Dan, my husband, he's a native of Utica, and he is a physical therapist, and he's retired, and we wanted to give back to Tabor, so we opened a fitness center there, and it's a nice combination. Most of the people there in the community are our age group, and certainly health is always on number one in the mind. So we've been able to be open and stay open, and we feel good about that. Joke is, Dan was the Hunhoff that really wanted to be a farmer and didn't have the opportunity with all the 7 brothers and didn't go that direction, so he thought his only option was to find an only child and to marry her that had a farm, and so he got his dream. So we have a small acreage right on the north side of town, and Dan does his farming that he does and really likes his old tractors, and we have 3 horses, and so doing well. We have 4 children, as I said, Matt and Kelsey here in Yankton. They have 2 girls. Then our son Nicholas is in Brookings, and he's a stay-home dad with 3 kids. And then our daughter Abby just moved to Brainerd, Minnesota, and she's starting a Teen Challenge program there for women. And she's going to have her 4th baby here at the end of the month. And then our youngest son, Paul, and his wife Darcy are in Oklahoma, and he's working on a PhD in educational research. So very few and far around here, but certainly family is priority in our lives. So that's the second thing that I think of. And I guess my history with the legislature, had some local government experience here in Yankton, serving on the city commission, and then served as the mayor for Yankton, and then ultimately ran for office. And so I've been in the legislature 24 years. I've served on various committees, and currently this is my 18th year on appropriations. In the last 8 years, I've served either as chair or co-chair on appropriation, so I have a real deep knowledge base, and I have a passion for what I do. I'm not a single issue person. I'm there looking at the broad perspective because I want to make a state or help to influence what we do in South Dakota that's going to benefit the children and that we're going to grow and have that great family lifestyle that we have.
So can you tell us what separates you from the other candidate?
Well, first of all, it would be the experience and the longevity. I think that certainly is. I think when we implemented term limits, and that's when I started in 2000, the challenge is if you've got 8 years, how do you move into leadership? And I think what I bring to the table as a difference is that over the course of time, I've built, number one, I'm respected as well as I respect my colleagues. And secondly, I've got a knowledge base, and they know and they understand that knowledge base. And you can ask any of my colleagues, nobody wants to come to appropriations because Hunhoff is going to drill them. She's got the data, she's got the facts, and she's going to make them really demonstrate that how they're asking and going to use those taxpayer dollars. You know, working in the legislature is really about relationships, because if you alienate people or you come in single focused, you can't get a lot done. So you have to learn, you have to negotiate, you have to sometimes give up your priorities and make it a win-win so that you can get things done in the state. And since my emphasis is on the budget, I'm really always, we have a balanced budget that's mandated by the Constitution. We're able to do that. We're able to look broadly across the state what the needs are in all the areas of South Dakota, in all the counties, in all the cities, and how we can use our tax dollars. Again, these aren't my dollars. These are taxpayer dollars. They work hard to earn those dollars, and I always respect that. So I always want to make sure that how we're going to expend those dollars, they're going to get a return on their investment. And so I think that, again, having history, it's when people bring bills or when they bring requests for appropriations, knowing what's out there, knowing what's in agencies, and knowing where to find those dollars. And most importantly, what is the question that you ask, or the questions, so that you know the answers, because that's going to lay the foundation or the framework of what you're going to do. And I think that that serves a great benefit to District 18. I've been able to bring a lot of things back to this community. And because I said I've got the respect and I've got the collegiality, I can get the members to go in a direction. It's going to benefit everyone, but District 18 is also going to be part of that.
So can you talk to the viewing audience a little bit about what it means to District 18 for you to serve as chair and in that senior role?
All right, let's just use this past year, all right, so, or the last 2 years, and I guess even when you're thinking about where the COVID dollars were, District 18, look at the funding. If you look at Yankton, certainly education, healthcare, and state employees are a big component of the population of this district. And over the course of the years, we've been able to do increases. And 2 years ago, we had a significant increase of 7%, realizing the workforce shortage. Looking at what are we doing for workforce shortage in this community, working with GOED in providing grants to communities. I believe recently you're working on a grant for daycare. Those dollars were appropriated through the appropriation process to come back to local communities, so made sure that is. When we look at other grants that we've done this year, especially with long-term care, we've got several nursing home facilities here in Yankton, as well as Wakanda and Irene that are in the district. We did some funding to provide, now they've got some access to grants that they can put telehealth in their long-term care facilities. For home and community base, we did funding of about $2 million for equipment that can come out that can enhance the quality of the patient, but also help to alleviate some of the workforce shortages and what some of this technology can do, so that when a nurse goes out to do a home health visit, she can draw the blood, send the blood sample to a lab, get everything done online, be able to adjust that medication for that patient and go on to her next visit. This district is benefiting from that. Again, teacher apprenticeships were another program that we've done this year. There's $8,000 going to that, and that's looking at your paraprofessionals. Yankton certainly is eligible for that. When the high school did their CTE project and their building, those dollars came through the budgeting process. So as we appropriated dollars for those kind of growth programs that we knew were going to be there, we've been able to do that. This morning I was just reading in a paper where a young man is going to go to law enforcement academy and work for the police. Where did that come from? That came from the technical colleges, the building South Dakota scholarships that we have partnered and fund, so that those students can have that kind of opportunity and they're going to come back to this community. I mean, when COVID was here, again, we made sure that those federal dollars allocated, Yankton benefited from that. Two things that I did during COVID that I think is important is that one of the things, when the dollars came down to education for everything that they had to adjust to and make those, there was nothing there for private schools, faith-based schools. So I worked with the governor. I said, can we get some of those dollars, because they've got some of the same challenges that we had. So faith-based schools that are in this District 18 were eligible, and they got dollars to supplement to help with some of the ongoing costs that they were going to have to absorb because we had the COVID. The other thing is, when we started the small business grant program for businesses so they could apply, the feds had the PP program, but we had a small business, we funded that. I got my colleagues to agree to do some grants to businesses that were in process. You know, they weren't eligible because they weren't up and operating, but they had already invested lots of money in doing a business, and now it sort of got stalled because the supplies they couldn't get. I convinced my colleagues, and we have several businesses in that community that were able to tap into that to help them during this transition period till they got up and running dealing with COVID. Meat processing plants. There were some that were in the surrounding communities that benefited from those small grants that we've got so that they could expand out and do some meat processing and serve those needs. You know, and again, I'll look at ag. How did it benefit? We've done a lot of funding for ag programs between SDSU, Dakota State University, and South Dakota School of Mines. How does Yankton benefit? Our kids are going to school. They're enrolled in those programs. They're participating in research, and hopefully they're going to stay here and come back to the community. So we've done a lot in the area, and I guess sitting at that table, I've had the opportunity to have the influence and to convince people. And again, my priorities are long-term care. When you look at South Dakota, 87% of our budget goes to Department of Human Services, Department of Social Services, higher ed, and K through 12. Those are all important industries in this district, and they are benefiting from those dollars.
So funding public education is the state's responsibility. What are your thoughts on how we continue to create outstanding learning environments for our youth?
You know, I think the first part is the listening part. You know, certainly the school districts, the teachers, you bring those people in, and all the course during the interim, you have meetings with them to identify what we can do, listening to school boards. And I already addressed, we've done some things, that quality education. You've got to have quality teachers, and you have to have enough teachers, and we don't have enough. So that's the reason we've done the apprenticeship program. The governor really took the lead on that, especially in other professions, not necessarily education. But this year, Dakota State and both USD got federal funding for some projects, and so now we're doing state funding so they can expand that work group, that those paraprofessionals can be working and continuing their education, and then they're going to come back into the school system. You know, I think when you talk about that, it's so important that we give the teachers the kind of support that they need. I'll give this example. Yesterday we had interim rules. Department of Education brought a bill on teacher evaluation, and they wanted to take out the metric that it is somehow based on how much the student learns. Again, not right or wrong, but if it's the right tool or not. And at the end of the discussion, I was put in a position, I had moved to approve, went 3 and 3, couldn't do it. Well, then we came back and they wanted to revert. Wanted Department of Ed to really look at that. Do you want to take that out, or is that important enough for teacher evaluation? Well, it came down, it was going to be a tie again, and there was no other options left there, and you have to act on something. So I said, okay, I'd support it. So we reverted back. Again, getting the input for the Board of Education is what they need. I know there's a lot of discussion about curriculums, and I know there's been a lot of debate about the social studies standard that has been out there. Again, we have not had updates, but we need to get that to see if that's working or not, and there's mixed views on that. You know, I think the other thing that comes into play is a sense that, you know, private education, you know, where do they fit in this spectrum? You know, parents have a choice, and that is absolutely right, but the state has a responsibility for K through 12 and spec ed. And so those that are in private, more power to them. There are already some partnerships that are going on and some sharing of resources, but I think we need to keep that separate. They can make the choice, and that's their choice, fine. But we've got to assure that every student that attends any of the K through 12 that we have in our district has to have the same equality as far as the access to the materials, the teachers, and we've got to assure, and I believe our role is to make sure that we have quality teachers here.
So would you support making the temporary state sales tax reduction permanent?
You know, I'm not going to answer that because I think the jury is still out that. We have a potential ballot issue that's out there, and that's why we put a sunset on there. We wanted to see, are we going to have 4 years of where we're going to have enough revenues to support the needs of the state? We're not at that point in time. Yes, we have been exceeding what our revenue projections have been, but this could be a game changer. The other thing is the economy. You know, you can be looking, and we use that to set our budget, but you've got to reflect and you've got to sort of look at the future. What are the needs that are out there? And again, those needs are not going to stop. We heard from the Economic Development Conference, housing, Yankton, that is certainly a big priority here. And I think the other thing that we talk about are medical needs, the access and all that, those are going down, and primarily workforce shortages. I just had the HR person run some numbers for me, and I wanted to look with public safety. Over the last 5 years, they have gotten over 100.3% increase. They needed to do that, so now starting pay is at $31. I want to see the same thing for corrections. And the reason I'm talking about this is because that flows over to local government and county government, because if the state is paying that for a state salary, that's who they're competing with. And I think that's the bigger picture. We're not going to see a stop in escalation of compensation for workforces. It's going to continue to escalate, and we're competing against each other. Is that right? I don't know how to change that. So you're going to have to look at that. How do you have the resources that you can supplement that? Because if you can't do that, you're losing people. At the same time, counties are having to pay more. Cities are, if you're paying more for those expenses. What about the other routine expenses that you have in your state and your county and your city governments? How are you going to keep up with that? So if you take the number one performer that's bringing us the largest return, sales tax, and you reduce that, you've got to look at a replacement. Now, some people will say you don't need to replace that. You make government smaller, because that's the other option that's out there. Well, if you make government smaller, then we're looking at all these programs that we're currently funding. Where does that fall to? That falls back to local governments then. Are you going to be able to absorb that? No. So, as I said, I'm not commenting at that point because I want to see yet what's going to happen with the ballot issue and what is happening with, are we still generating the dollars that we need to meet the demands of the state?
All right, so for the viewing audience, this next question is a little bit long, so be patient as I lay the groundwork here. So there are 2 ballot measures circulating that the state cannot tax the sale of anything sold for human consumption except alcohol and prepared food. Both say municipalities may continue to impose these taxes, but there is definitely a question about how that would work. Sales tax streamlining laws that allow us to collect sales tax on remote sales say the state and municipalities must have the same base, so they have to tax the same items. They do not have to tax the same rate. So the state can tax at 4% and the cities at 2%. If either of these measures passes, it would take legislative or court action to keep the food in the base, but have the state rate set at 0, leaving municipality sales tax in place. First, do you support eliminating the tax on consumables? And if this is passed, would you support legislative action allowing cities to keep their base on consumables?
I would not support a change to not have a tax on consumables. I am not for that. Again, I just alluded, that's our largest resource. You take that out, we're talking probably a little over 100 million. And now with the current reduction that we have in the 3/10, that's another 100 million. So that's 200 million that would be wiped off. If you listen to this past session, the other interest that has come up is property taxes. People are very unhappy as what's happening. And it could be the model that's out there, and there's going to be a summer study to look at that. So if you've got those individuals, those people that are concerned that they don't want to continue because the property taxes are escalating so much they can't even afford to be in their homes anymore, and then you take the sales tax off, now you really got a double whammy that's going on. So where do you get the tax dollar to support everything else that is happening? Because the other needs that we're currently funding, state government overall, it's not going away. And the only way, as I said earlier, is you start the chopping block, and then you help me decide who you're going to cut off and what are we going to salvage and what is going to be the basic form of government for the services that we provide to the public. Again, if that would go through, I guess I would support cities being able to maintain what they consistently have, because again, that's their source of revenue. If that goes away, then they're going to be looking more to the state. How are you going to help us with the projects? We need more dollars out there. So it's just like circling a drain. As you take all the water out of there, what do you have left to work with? And you're not going to have much.
So your answer was a nice segue into the next question about property rights, when we were talking about property taxes here. So there is tremendous dialogue across South Dakota regarding personal property rights when it comes to large economic development projects. Share some of your thoughts with the viewing audience so they better understand your views and what you would support so South Dakota can continue to bring large-scale projects to South Dakota.
That was the number one, certainly challenge this year in the legislature. And there was no win-win because unfortunately, the ag population or the ag producers, no matter which kind they are, they were divided. And when you look at economic development, with ag being number one in South Dakota, that means you have to have businesses that come in and that they utilize the products that farmers are producing and that also ranchers are producing. So that's where the income comes in. And I think, I've tried to play this out in my mind, and I know people aren't happy about the vote that I did to support 201. But at the end of the day, again, it was split. And if you're looking at economic development, 201 was to protect, if this does come to fruition, that there would still be the rights, that the farmer would be protected with the easements, with any risk management issues that were out there, with the using of that property and the length of those easements and everything like that. I have to go back in history a little bit. If we had that same thought process that, we're not going to do this, then we wouldn't have utility companies, we would not have REAs. I understand that people are concerned about the safety. And in doing a little bit of research on this, there's been one potential breakdown in a pipeline, and that was down south. But that's a one in a time, and you look at the others that could be happening. And I think the other one, they say about corporations coming in and doing that. As I said, people are depending upon those businesses, those corporations to buy their product. And if you don't attract them to the state, how will these producers get anything for their crop? And how far, if they have to transport out of state, that's very costly to them too. So I take a broader perspective. I want to make sure that we are protecting those landowners, but also acknowledge if we're going to have economic development and people buying the product or corporations, then I think we have to open our mind up and have a little bit of flexibility. And I really don't believe it's taking the land away, because some of those producers already have utilities that are there, so they've had the experience. I think unfortunately the way it started and the way the treatment of the producers was not right, and that set off a whole firing squad of everything that's bad about this as to whatever. But I'm going to share one last story because I've been thinking about this. They talk about big corporations, but big corporations even have small beginnings. I think about Poet and I think about Mr. Bryan. So I'm going to say this. When ethanol started in South Dakota, it was a little plant here in Yankton, South Dakota, and a gentleman by the name of Red Dreyer opened it up. And it was a far-fetched idea that you could convert corn into a producible product. And he saw that, and he relocated to Scotland. Well, at that point in time, there were a lot of challenges and a lot of obstacles, and here comes Mr. Bryan, who sees an opportunity. Well, let me say Mr. Bryan's wife worked for one of the programs I operated as a housekeeper and a helper with individuals for personal care. That is one of the lowest paying jobs that you have. Most important, in my mind, as far as providing care for our elderly, but the lowest paying. That's where they started. And she worked and she provided an income for them, and did that. So you've got a homegrown person that started here, and then he made the right business decisions. So to me, it is a story about someone that starts really at the bottom, works their way up in the top, and now, has the corporations, is doing business, supporting the ethanol plants here in South Dakota. So I have to look at it in that area that, yes, they're a corporation, but their humble beginnings were here and just demonstrated what good business decisions and the networking opportunities and that he took as a business person, and what has now resulted as a major industry for economic development here in South Dakota and also outside the state.
So it's nothing new that the 66 counties in South Dakota are struggling financially. The summer study in 2023 brought forward several ideas. What do you think will create a positive impact for county budgets?
I think this is a beginning, but it's not the solution to what counties are doing, because all we did, in a sense, with the legal defenses, we started a commission that's going to help take some of those cases, and we also are funding some of the costs that counties are going to have. But that's not ongoing. Now, it could be with that program. We're going to, I believe, ongoing with the commission. And then as they take on more and more and expand out their services, they probably will be absorbing more additional defense costs. The cybersecurity, that is a startup for local government so that they can access grants and get some programs implemented. I mean, we're looking at the basics at emails. I mean, that is simply basic. If we can get that in. But the notion is, and the understanding with those local entities is that they're going to have to take on the maintenance costs. So again, that says that there's no new revenue. It's startup to get you going, but then you're going to have to generate, and we know what counties are fighting because we can't get anything than the 3%. They've tried to implement a sales tax that just does not fly in South Dakota. You know, nobody wants to talk about this, but the real concept, because of the population and the demographics of the state, is that regionalization. Are there more services that counties can share? Counties, cities, the state are all independent bureaucrats, and they don't want to be told what to do, and it's very difficult to give up that control. But I believe that we can show some examples. You know, I think there's 14 or 15 counties that are at high risk for going bankrupt. A lot of those on reservation land or have a lot of federal land that doesn't pay taxes. So that's sort of their challenge in that. And you know, we tried to do the regional jails concept a couple of years ago, and that wouldn't fly in the legislature. I think if we did more incentive and carrots for regionalization, that we could consolidate some of those counties. So you wouldn't have duplicate services for the population you're serving. And you know, I tend to go back to my Bonham County. That's not my district, but you look at the number they've got right now. They've got 3 high schools in a population of a county of 2,200. You know, that in a sense, you wonder how that can be user effective. And the same thing in some of the services for cross counties. I know there's discussion in our own Yankton County about opportunities. You know, they're looking at doing a juvenile detention center. I think you need to look at, do you have the workforce to support what you're going to have? They've talked about sharing of some veteran service officers. You know, I think if there would be a beginning, some partnerships out there. Let's go back, way back, Nancy, when you were mayor, and even before then, when we started the waste pickup program with Vermilion. I remember how Phyllis Packard pioneered that and how controversial that was. But that's one of the best things that I think that has happened, has been very cost effective for both communities to share that recycling program, as well as, you know, what we do for getting rid of our garbage. So, you know, I think there are examples, but we have to break down the barriers and come to the reality that it's the taxpayer that's not benefiting by having all these separate programming in each of the counties. Can we start small, do some? And so that's my answer. Begin small, looking at some partnerships that we can do, see if we can make those work. Maybe you can still be independent and autonomous, which you probably can, and some services can stay the same or whatever. But I really think that because of the population demographics for the middle of South Dakota, we're going to continue to see a decline and not an increase. In fact, if you look at my statistics again, if you look at death rates, in most of the counties, including Yankton, death rate was higher than birth rates. So that tells you right there, you don't have an incoming workforce.
Which also segues into the next question of workforce, which is a continuing challenge in South Dakota with an unemployment rate around 2% and such a large percentage of both working parents here in District 18. What ideas do you have for increasing our workforce so we can continue to support our key industries? Agriculture, manufacturing, tourism, and healthcare?
Loaded question. I think we need to expand on what we're doing. You know, I'm going to go. We have found, and I think if you look at national statistics, if you can get your in-state youth to stay in the state, that's your that's your first option if you've got that. And I think we're trying to do everything we can to make sure that post-secondary programs are getting our high school students. And I'm reflecting on Yankton, just the story in the paper this morning, and the work initiatives that is being done through your office and others in getting kids interested in programming. Continuing, you know, we're doing our 3rd year at universities freezing tuition. I don't know how long we can continue, and I don't know how long that can be a significant factor, but right now it is. The technical colleges are taking off. I mean, just astronomically. So we've got to continue to expand on those, but we've got to nurture our own. Anything we can do to get programs working with our high school kids, even middle school kids, to get them interested in professions. You know, the professions are partnering with the state in a lot of the healthcare programs. Certainly we're supporting the med school, we're supporting nursing programs, putting a lot of dollars into that, and I'm holding those programs. I said, I want the metrics. We're putting these millions in there. So at the end of the day, in 5 years, see those number of graduates that you are projecting out. But the issue is we're never going to have enough of healthcare workers for what the needs are that are out there. And again, making sure that we're compensating those individuals, so we have those incentives, the apprenticeship programs that we're doing, and we've got to continue to work with the feds with immigration. We've got to open that up, that legals get over here and we work with them. And we're doing a lot in those that are coming over, and we're getting them relocated, but it costs to do that, in the sense if you have those, you have non-speaking individuals, you have them with their different cultures, you have to do all kinds of things in a community to incorporate those individuals. And I think the other untapped is our reservations, and right now there are some tensions that are out there, but we have to continue to find partnership opportunities that we can employ. That's a large employee workforce that is out there, and somehow we've got to continue and to identify, but they've got to be working partners with us, and that means we need to sit down face to face and find out what is it that we can do to help those kids so that they want their post-secondary. Higher ed is doing that. SDSU, University, all programs with their cultures are certainly incorporating, and you are seeing increasing numbers of Native students going to our schools, but it's a small number, and we need to work to enlarge that. And I guess the other thing is, as we're talking with corrections, I think we need to do a major look at what's being done in corrections, so that we've got job training going on there, rehab services, so when those individuals, both men and women, come out of those facilities, that we've got them entered into the workforce. Now, it may be a lower level workforce, entry type of things, but I think that with the right resources, and I think we're short on that, and I think that's another thing that we need to look at more globally, and really the legislature needs to put some attention in what do we do for rehab, and what do we do for retooling these individuals so they become productive citizens when they come out of there. So that's another one of my priorities that I would hope, if I get back to work with appropriations, is to start looking at that and work with the Secretary of Corrections and looking at what kind of programming, what's happening now, and what can we do better, and how do we get to that point.
And I hope some of those ideas are incorporated into the new facilities that are being built West and East River, as we look at our prison system and how we can do things maybe better and more efficiently.
I'm told we are, but again, facts have to be out there. One of the things that I think that the Secretary has done that, is sometimes a consternation is, it used to be that the behavioral services were provided by the Department of Social Services and Corrections had a contract. Since the Secretary came on, and from her experience and from research, it is apparent that if you have your own staff, that you're better at developing the right behavioral health programs that you need. And so that has switched over in the last 2 years. So those behavioral health employees no longer report to Department of Social Services, but they report to the Secretary of Corrections. So I'm hoping that we're going to get some updates on that. How's that working? What are we seeing for recidivism? What are we seeing for the growth of behavioral health programs? Probably about 4 years ago, 3-4 years ago, I put out got the legislature, and that was when we had some federal dollars available, to put out $5 million to be available for a women's rehab drug program. Didn't have any takers. I now know that I believe Yankton is going to be doing something in that area, some partnerships that are creating out there. But that's really important, that we don't have a focused program on women, because there are special needs out there. Most women have children that they're raising in addition to maybe being pregnant at the time and being in treatment that way. We need to look at some different options, and we've got to look at some different models, and that takes change, and unfortunately change also takes dollars. And the question is, how do I know I'm getting the return on the dollars we're putting into that program? Sometimes we have to be just trial and error and give it out there. So I'm hoping that these dollars in the 2 or 3 programs that have taken those dollars and piloted, we will be going back and say, now show us the numbers and show us what's happening. But that's how you see success or you see failure. And people don't like to see failures because you're paying for failures. But if you don't make mistakes, you can't do better. So part of that is that we all have to understand that there are some failures along the way, but we're focused on the successes and how we learn from those failures to get to those good points.
So as I go back to talking a little bit about workforce, what are your thoughts on automation and how that could impact uh, businesses here in South Dakota?
You know, I'm for automation, but again, it's got to be a balance. And I know there are people that are scared because they say if automation comes in, it's going to take my job away. That's not the condition at all. I think it will enhance so that maybe you won't need as many employees. I mean, some of the things that are happening, again, I go back to healthcare. Certainly the automation that they're doing with telehealth and things like that. There are robotics that are delivering meals, trays to people in dining rooms because we don't have a dining staff anymore to do that. I think that there's going to be more innovation that's out there. And I think USD has gotten some grants on that innovation, especially in medical equipment, and they've even developed higher ed degrees in that arena. I think that is going to be an answer. You see it in manufacturing. I mean, they've got automation. The problem is when you're making pieces or widgets, it's easy to do automation. When you're dealing with people, it's a little different because they're uncomfortable and it's not necessarily, but I think you can get warm to a robot. And the technology that I'm seeing for robots is just amazing. And, I think when you come to the bottom line, if you don't have that, I'm thinking about even with cars. I'm not for electric cars and I'm not for you don't have a driver. But maybe that's an answer, if they retool that and get that to where so that I can have health providers that can be charting or working on things rather than keeping focused on the road. Maybe that's an answer. I don't know. But I think we have to think outside the box. I'm not necessarily the most creative person, but I think that we have to look at technology and how we blend that and convince people it's not going to take your job away. It's only going to enhance it because hearing people how they have to do more and they're overworked and how the stress adds and then they're ready to leave that job or leave the workforce. That's not a positive then. Then we've really lost out because chances are they may never come back to that job, which right or wrong, or they may not decide to continue in the workforce. They just can't deal with that. And again, that's not an outcome that we want.
So child care is another issue very important to families. The Department of Social Services has a program to support low-income families offset the cost of child care, but a low percentage of families utilize this program. In Yankton, our reports show very high demand specifically for infants under the age of 1. There is no one answer that can solve this issue. In your opinion, what can be done to support all families having adequate access to child care?
One, you have to have providers. And again, there are dollars. I know that the state is doing a study right now. And I think the other thing is partnerships. It's partnerships with business. I don't believe that the state wants to expand their subsidy program. I know they don't. But they want to engage the employers and say, how can we work this together? Can we help with startup? Would be my idea, so that you can get a provider in there, help them with recruiting their workforce, but recognizing that we're not going to pay your workforce ongoing. Let's do some startups. Let's partner with the employer and see if we can do something together that way. I think the other thing that you're touching on, those people, we need to find out why they're not filling out the paperwork. That is not just in daycare. It is in everything. The comprehensive paperwork. We have brought people in to GOAC and the state, and for example, Medicaid is a 15-page application form. Well, believe me, we have troubles just filling out forms. And when we got the forms and you go back and you say, can you simplify it? No, the feds are the one that are doing that. So I'm trying to address it from the feds angle. Currently, I am co-chair of the National Council of State Legislators on their healthcare committee. And my focus is on bringing discussion on the regulatory side that providers have to do in healthcare. And part of that is this Medicaid application. And I know there's a concern, always a concern is that it's going to be abused and the wrong people are going to be accessing. I think that's a misnomer, and I think we've got to get on task and start forcing changes in some of these documents. And the same thing, when we talked, you're on daycare and I'm not deviating, but one of the issues was with food. Kids, schools not having, again, they didn't want to do the paperwork. I think that's a deterrent. Now, is that supposed to be the carrot that you do this, then you're going to get it? I don't think so. I think we have to change that mentality, and any place we can do it along state government, we need to simplify that or have resources to help these people to complete those applications. We can't give up the owners, the parents have to be engaged. They have to be the ones to do it. But let's give them tools, let's give them assistance so they can fill those out. And back to your question with the daycare, I think that's it. We need to find out why they aren't completing those, what are the resources we need to get in place, and how do we get that done?
Yeah, so within Yankton County, only 4% of people who are eligible actually utilize the program. And when we have the results of our child care study released, and there will be a printed copy of that available at yanktonsd.com on the Yankton Thrive website, I think a lot of things are addressed in there, because some people answered the question of why aren't you utilizing the program. Some of that is if you have the father on the birth certificate, they have to be included in the process, and some of those people come from abusive relationships and do not want the father included, so then they get excluded from the ability to use the program. I do agree with you, sometimes the paperwork is the deterrent. So are there multiple programs that could have a universal application with the right questions to give that application the ability to fill or the needs of multiple agencies rather than filling out the same thing multiple times? Because I know for a lot of families, having the income paperwork or previous tax returns or other things available just become very difficult and cumbersome to put those documents together.
We were trying to do that. We weren't looking at this program. We were looking at the human services for one-stop shopping. I can't think of the program right now. And we did a lot of discussion, and we had small work groups trying to work with the department and doing something similar. Didn't get very far, and I think that we have to continue to pursue that, especially with DSS and because DSS is the payer. DHS is the one that signs up the people to utilize the services. So yes, I think that is. But again, that is a change, and people are so rigid. They don't do that. And then the other factor, go back to the feds. They mandate, because if you want the federal dollars for the match, for the Medicaid, you have to play their game. So that's why I'm saying I'm trying to attack it at a national level, that I can get enough states interested, because they have to be experiencing the same things we are, and then come back to the state and find where are those similarities. That takes time. The only time that we have is during the summer in the interim. So then you are asking legislators to take their time to come to work group meetings, to do things, and not everybody's on that page. There are those of us that are very passionate and will do it, but there's not enough of us. And so that's part of the challenge, how I can increase that participation and how we can do things on Zoom and get those departments. The other thing is, we go after departments on many, many things. And right now, Human Services, they have just finished or starting out a whole comprehensive review of their services. And with the disabled population, developmentally delayed, they are doing a massive study on that. So if you go back and you ask them to do these things, they're overwhelmed, and then they're not getting their work done because they're trying to pacify this legislature in doing that. So really looking at a comprehensive plan and how to get that done. Unfortunately, government is slow, and that's my frustration, because even when we do funding, we are now doing letters of intent to send out to agencies. If we're doing grants or we're getting funding dollars, those funds have to be applicable. The applications have to be in by July or August at the latest, and the dollars out the door, because you've got groups that are waiting for those dollars and nothing's getting done. And then there's frustration from everybody. So, you can only put so much pressure on. You have to find out what's realistic. You've got to work with the agencies, and the agencies are very amenable to work. Don't misunderstand me on that, but it's just a time factor. And the answer that they tell us is, I don't have the staff, Senator. You want me to do this, I can't pull somebody off of somebody else. They come to ask for more employees. What's the first thing I say? No, you've got enough FTEs, so how do you balance that? I wish I could answer that, and I think you're right on those questions. It's just that, how do we get the right people at the table and get it done in a way that it's easy to do for these individuals to sign up? But again, the carrot being, you sign up, you're going to get the benefit, not the stick to say, you don't take the time, but we got to figure out why.
I just want to make a personal comment in regards to child care of people with special needs. That was another item that came up in the survey. So as that work group is looking at how they can address people with special needs and some of those services, the daycare services are something that should be considered as a part of that discussion. And then you also use the acronym GOAC. So anyone who's not familiar with that, if you could explain
Sure.
what GOAC is?
GOAC is Government Operations and Audit. It's a committee of the legislature that only meets during the interim unless there is a bill introduced through the committee during session. Our intent is to look at operations of agencies. Unfortunately, about 5-6 years ago, a legislator thought it was a great idea to combine our quality indicators for the agencies with GOAC because they thought it was process. The problem is now we're dealing with metrics, and it's 3-year-old metrics. So an agency comes, they have 3 years to give us new metrics as what they're measuring, and then they come back in 3 years. That's not, to my mind, what we need to be doing. We need to get in the operational part of what's going on. Give you a case example that I'm drawing interest on. With the housing shortage, we did a fall tour of Springfield, of their housing project. Well, mixed messages are coming out of there in the sense that what they had suggested to us was the supervisor. South Dakota Housing runs the housing building program out there, so their employees oversee the program. Those that were overseeing it said, you know, we've got not really enough people to oversee, so we can only have so many inmates. Well, then we learned that the inmates, the stick that the Springfield uses, which either right or wrong, not judging, is that if an inmate doesn't show up to work, they're out of the program. Well, when it gets cold, people don't like to go out in the cold, so the inmates tend to drop off from participation, then they can never get back on. So I'm pulling together and going to bring it to GOAC to bring both the corrections and housing in to discuss this, because the other thing is they've been so backlogged, they hired a private contractor to finish building some of the projects because they need to get done, they need to get out the door. So I think it just raises, and that's what GOAC does. It looks, what are the processes that are occurring, what are the operations. You know, this really came out after the Platt incident where, you know, we had the fatalities that happened and all the outcomes of that. And so that was really where GOAC was start focusing on some of those issues in some of these agencies. But you've got to know what's going on, and you don't know that. When they come through their budget, you don't always pick that up, and you might pick it up someplace else. So that's where history comes into place. So you know what's been there and what isn't occurring or why something different, what they promised you and then didn't deliver, and nobody ever followed up and said, why didn't that get done? So we're really looking at the process of operations in agencies.
And who serves on GOAC?
Both the House and the Senate. It's completely composed. There's a co-chair from the House and a co-chair from the Senate. And then I think there's a total of 3 members from each house, so there's 8 or 10 members that are on the committee. And again, we only meet during the interim, so we have our first meeting coming up, I believe, in June. And we'll look at metrics of agencies that are due now every 3 years, and we'll hear what they're going to do. You know, that's fine as far as I'm concerned, and yes, we need to hear that, but you also need to hear other things that are operational. And when there are concerns that are expressed and they sort of mumble through the legislature, and a legislator picks it up and says, well, I heard this, and then you get a lot of rumor mills. And so you need to get the facts out there. And again, agencies are not intentionally doing the wrong things, but sometimes change is difficult, and you've got to have some kind of question that is out there to force the issue that maybe something is better to be done.
So Jean, is there anything you wanted to cover today that wasn't addressed in one of the previously asked questions?
You know, this is what I want to say. You know, and I have the fortune that I am retired, or not retired really, but my passion is the legislature. I give 365 days a year to the people of this district. There during the legislature, I serve on joint appropriations. I'm co-chair. We meet over the interim. I'm chair of interim rules. We meet over the interim. I am a member of the Government Operations and Audit. We meet over the interim. Last year, I chaired the task force on long-term care sustainability. This year, I know there's the property tax one. I applied to get onto that committee. I don't know if I will. I have worked with groups in the interim, and I will say the DD population developmentally delayed. The ABS of our community is an example of that. For the last 3 years, have been working over the summer with those groups, trying to identify, because they're totally 100% Medicaid. That's all they get. And if they're not getting the full reimbursement, then they're struggling and they have challenges. I've served on the methodology committee with those. What I'm saying is, when there's an issue out there, I will work with that group over the summer, either creating a task force and appropriations or just pulling a group together. This summer, I'm going to look at domestic violence and abuse because the federal dollars are going away. Those needs are escalating. This year, I got my colleagues to put $5 million of one-time dollars into that fund to allocate to those agencies that are servicing. That's not the answer. We cannot continue to use these one-time fundings. We need to look at where is there a source of revenue to keep these programs going because, again, unfortunately, values are changing and we continue to see an escalation in the use of those services and the needs that are out there. So what I want to say is I don't just stop at the end of session. I want to be there for the whole gamut. I want to be knowledgeable. I participate at the national level because that's where you can get input in, and I have made that my priority. My family supports that concept because they know Jean's going to do that. That's just what you do. You give 100%, and I believe I continue to do that, and I want to continue to work for the people of this district.
Well, Jean, thank you so much for joining us here today. And for the viewing audience, once again, June 4th is when we will have Election Day, and there will be early voting available as well. Thank you so much. Appreciate your time.
Thank you.